Hello, everyone. Good afternoon, I suppose. Thank you for joining us for the Long COVID and Your Rights Roundtable discussion. My name is Natasha. I'm a law graduate with Disability Rights New York, and I will be moderating today. So my pronouns are she, her, hers. I'm wearing a black turtleneck, glasses. My Zoom background is blurred out. I'm a white lady. I got dark hair. It's my description for all of you. For the first hour of this event, we will hear from our speakers about what long COVID is, its symptoms, how it affects day-to-day lives for those who have it, and then some tips for self-advocacy and the legal rights of those who have long COVID. The last 20 to 30 minutes will be reserved for questions from you all, so please feel free to add questions in the chat as we go along or during the question and answer period. With that being said, please know that this event is currently being recorded and we will be posting it on the Disability Rights New York YouTube channel. So be mindful of that and including any personal information in your questions. Unfortunately, Dr. Perlis could not join us today. And one of our other speakers, Dr. Chen, is in the middle of a patient emergency. Sometimes that's just the way it is when you have doctors speak on a panel. He should hopefully be here late, but with that being said, I'm going to hand it over to our other very impressive speakers to introduce themselves before we begin our discussion. So I will start with Lisa.
Thanks, Natasha. Hi, everyone. I'm Lisa McCorkell, and I'm the co-founder of the Patient-Led Research Collaborative, which is a group of people with long COVID who conduct research on long COVID and advocate for people with long COVID and associated conditions. So we actually conducted the first research on long COVID and have been doing research ever since. And I am a person with long COVID. I got COVID in March of 2020 and have continued to have symptoms since then. I use she, her pronouns, and I am a white woman with brown medium length hair. I'm wearing a dark green shirt and I have a blurred background because it's a bit of a mess back there. So don't want anyone to see it. I think I'll pass it to Jessica.
Thank you. Hi, everyone. My name is Jessica Richwalder. My pronouns are she, her, hers, and I'm a senior staff attorney at Disability Rights New York. Disability Rights New York is a nonprofit law office that provides legal and advocacy services to people with disabilities in a variety of contexts. I am a white woman in my mid-30s with dark blonde hair and light colored eyes. I'm wearing glasses and a white collared shirt today, and my background is blurred.
Great, thank you. I will give Dr. Chen the opportunity to introduce himself when he arrives. But until then, we are just going to get started. And the first question I have, the first sort of basic topic to address is, what is long COVID? And I'm going to hand that question over to Lisa.
Thank you. Yes, I'll give a brief description. This is Lisa. I'll give a brief description as to what the definition of long COVID is, and then kind of jump into some of our research and the research that's been done. So the way that the World Health Organization defines long COVID, and I might need to pull up the exact definition, is that it's a series of symptoms that results after a confirmed or suspected COVID-19 infection. And the symptoms last for at least 2 months and can start within 3 months after the infection. So it's kind of confusing, but it's an important definition because often what we see with long COVID is that the symptoms don't immediately follow the infection. You might see a recovery of your initial infection and then symptoms pop up a month or two after you've recovered. So that's an important part. And it's really just this extension of these symptoms, this prolonged symptoms after your COVID infection. So this is from our research, which we published in the Lancet's eClinical Medicine. 200 symptoms ranging all body systems for people with long COVID. The top 3 symptoms that we found are fatigue, post-exertional malaise, which is the worsening of symptoms following any type of exertion. So what that symptom is basically if you exert yourself in any way, physically, mentally, emotionally, you have this worsening of symptoms or new symptoms that pop up, but it's a delayed onset. It's about 12 to 48 hours. So you might push yourself, maybe you exercise, and then the next day you're having all these symptoms pop up. The last top 3rd symptom is cognitive dysfunction or brain fog. And that can have a very that can be very impactful for folks. The onset of these symptoms and the time course, so how they're prevalent throughout someone's course of illness really varies across individuals and by type of symptom. One of the interesting things we found is that neurological symptoms, so kind of like that cognitive dysfunction and other neurological symptoms, can have a delayed onset. So you might not see it right after a COVID infection. And it's also something that is very episodic in nature. So we found that the vast majority, 85.9% of people with long COVID experience relapses, with a lot of common triggers being that activity, stress, menstruation, and it can have this waxing and waning nature. That makes it really hard to plan and have kind of a stable type of illness. This is from a paper that was just published a couple weeks ago that I was an author on, that reviewed all of the long COVID research we have to date. And when I'm not presenting, I'll share the link in the chat. But this is kind of just an overview of different symptoms. It's not all the symptoms, not 200 symptoms, but some of the symptoms, and then also what might be causing those symptoms. So we can see that it really impacts every organ, impacts every system. And there's a lot of different pathologies, different pathologies that could be the cause of these different symptoms. It has a huge impact on work and life. So we found in our survey that 67.5% of people with long COVID had their work affected due to their illness, majority requiring a reduced work schedule, 22.3% were not able to work. This is especially due to the cognitive dysfunction, that brain fog, where 86.2% of people were, even if they were working, were mildly to severely unable to work. They weren't able to do what they had been previously. We found that many accommodations do help with being able to keep people in the workforce. So teleworking, that has been huge for me. Only reason I've been able to continue working. Flex time, another big one for me, being able to kind of set your schedule so you can take breaks throughout the day. Moving to a role with lower physical or mental strain, and a variety of other accommodations. But it's really not just work that's impacted. It really has a huge impact on every area of life. So some people who have continued working, that's all they're able to do, right? If you're trying to just get a paycheck and you're worried about losing work, you might only have the energy and ability to work. And so things like chores, errands, hobbies, your social life, keeping up with relationship, that goes out the door. So that's an important aspect that isn't easily, or it hasn't really been measured as well in the research, but is something we know that's happening. And so that also impacts caregivers and loved ones and the amount of work that they're doing as well. So even if, folks are not able to work, all of these things can be impacted as well. We have many people with long COVID who are bedbound, who are housebound, who, have really had a severe impact on their life and livelihood. This is some research that just came out earlier this week or over the weekend. And this is from the New York State Insurance Fund. And they found that 71% of people with long COVID who submitted a workers' compensation claim either required continuing medical treatment or were unable to work for 6 months or more. And over a year after getting COVID, 18% of these claimants with long COVID had not returned to work, with the majority being under age 60. We know that this is an undercount, and the report states it's an undercount. In order to even be approved for a workers' compensation claim, you needed to have a positive COVID test, which many folks don't because of the inaccessibility of COVID tests. And so we know that for that reason, and just the amount of people who have access to workers' compensation and the ability to apply, it's an underestimation. But I think is a really important thing to share. There's often a narrative with long COVID that if you do get it, you'll recover quickly or, within a few months, under a year. I'm living proof that that's not always the case. I've had long COVID for almost 3 years now, and there's many of us that have. And a lot of it is because of the diagnoses that we're receiving. So these are some of the common diagnoses that people with long COVID are meeting. So one of them is myalgic encephalomyelitis, chronic fatigue syndrome, or ME/CFS. About half of people with long COVID are meeting the criteria for this condition. And this can be a very severe condition. There's a significant lack of research and understanding by providers of this condition, but it's very severe and generally lifelong. Another is postural orthostatic tachycardia syndrome, or POTS. And about 2/3 of people with long COVID, including myself, are meeting the criteria for this condition. This is a form of dysautonomia where your autonomic nervous system is not functioning correctly, and it causes a lot of the symptoms we're seeing in long COVID. Again, this is generally a lifelong condition. Other diagnoses include mast cell activation syndrome. This is where your mast cells, kind of what's in charge of your allergies, overreact. And then small fiber neuropathy. Ehlers-Danlos syndrome is being diagnosed now, but it's actually a comorbidity. So it's not something that COVID causes, but it's being diagnosed now because people with long COVID are more exhibiting the symptoms of it, and we're finding it as an underlying diagnosis. So that's another important one if you have long COVID to ask your doctor about. Okay, I think that gets into the next question, so I'll stop there for now.
Great, thank you so much, Lisa. A lot of great information. The next question is who is most likely to get long COVID? And that's sort of a compound question, because the other part of that question is what can you do to prevent getting it if you don't already have it?
Yeah, I will. Okay, I'll share again. Sorry for this. Okay. So first I'll touch on just how prevalent long COVID is and then get into some of the risk factors. So what we're seeing is that long COVID comes from about 10 to 30% of non-hospitalized cases and 50 to 70% of hospitalized cases. So what that ends up being is because most people are not hospitalized. So what this means is that because most people weren't hospitalized from COVID or aren't hospitalized from COVID, the majority of people with long COVID actually had a mild case, or what's considered mild. I feel like personally, my case of long COVID or my case of acute COVID was not necessarily mild. I didn't have a fun time, but that's, you know, it meets the definition of mild. So it's important to keep that in mind because it's very prevalent among people who weren't hospitalized, who had an initial mild case, even comes from people who were asymptomatic. So it's really anyone who gets COVID is at risk for long COVID. The Household Pulse Survey estimates that between 6 to 8% of all US adults currently have long COVID. That means that about 15.5 million at least adults are currently experiencing long COVID. We see a higher prevalence among the Hispanic and Latino population. And very important to keep in mind, a lot of this research is done on adults, but children are impacted as well. And we're seeing lower prevalence, but still, you know, between 5 to 10% of children who get COVID can develop long COVID. Vaccination can provide some protection, but it's not full protection. So we're seeing that it reduces rates between 15 to 50%. So meaning that still 9 to 15% of vaccinated people develop long COVID after COVID infection. So it's important protection, but still worth using other forms of mitigation to try to not get COVID. And that's something I don't have a slide on, but I'll speak a little bit to, is just to the best way to not get long COVID is to not get COVID. So continuing to mask indoors, trying to improve ventilation if you have the capacity to do that, and you know, calling on your representatives to take COVID seriously and really focus on this as an issue are all important steps to take. These are some risk factors that we're seeing from the research, but it's still developing, this type of research on long COVID. So this is just a little bit of what we've seen. So we've seen that females are more likely to develop long COVID, people who have pre-existing type 2 diabetes, Epstein-Barr virus reactivation. So this is Epstein-Barr virus or EBV, also known as mono. So that reactivating in your body can also be a trigger of long COVID. People who have connective tissue disorders, which I spoke of earlier, that's Ehlers-Danlos syndrome or EDS. People who have ADHD or attention deficit hyperactive disorder, might have gotten that wrong. Apologies for not writing that out. And then chronic urticaria and allergic rhinitis are also risk factors. We also see socioeconomic risk factors. So people who have lower income and people who were not able to get adequate rest in the early weeks after getting COVID are more likely to develop long COVID. So we're seeing, you know, if people don't have sick days or the ability to take time off when they have their COVID infection, they're more likely to develop these very debilitating symptoms. Okay, I think that covers that one.
Great, thank you. Our next question, I don't believe that Dr. Chen is here yet, so we're just gonna keep it moving. But our next question, we're going to transition into some sort of tips for self-advocacy and the legal rights of someone with long COVID. So this next question, Lisa, thanks for holding down the fort. This will be for you, but also I know that Jessica has experience with clients who have had long COVID, so feel free to add anything you'd like, but this next question is if someone is experiencing long COVID symptoms, what should they do? So what are some tips for self-advocacy with doctors, with employers, for those with long COVID? And I will let you start again, Lisa. Thank you.
Sure, thank you. Let me pull this up. This is Lisa. Can you see my screen?
Yes.
Oh, great. Okay. So the first thing to do if you're it happened again. Okay, let's try this again. All right. So the first thing to do if you have long COVID, or if you're experiencing any of these symptoms, is to know that you're not alone. It can feel very isolating to experience these symptoms. It's very confusing, but know that there are millions of other people who are in your same position, who are experiencing these symptoms. And I think it's important to know that you're not alone in this. There's many others out there, and we have really great researchers that are working on trying to find solutions. And yeah, I think it's just, especially at the beginning, this was a lifesaver for me, was being able to find other people that were going through a similar experience and being able to talk to them about it. So that's when I joined a support group. I recommend the Body Politics support group, which is hosted on Slack. And just finding. Hello. Okay, there was a bit of a great. Just finding other folks who are going through it, I think, is the biggest support that you can have through this. Also, this book, The Long COVID Survival Guide, came out in November, and this is basically a support group in book form. So it is 12 chapters of advice, of tips, of ways to find a diagnosis, how to read research, all written by people with lived experience of long COVID. So if you don't feel like you're able to join a support group, if you're not really online, I do really recommend this. And we're trying to get this into many libraries. So ask your local library for a copy. And I know I'm plugging it. I am an author, I should say that, but I don't receive any royalties from it. So I really just think that it's an amazing resource, and think that's a good thing to get yourself if you have long COVID, or if you're a caregiver, or if you know someone with long COVID. The other thing to do is to pace. So this is an energy management strategy where you really work within how much energy you have for the day. You don't push yourself. You rest before and after activities. So I'll include a guide for that in the chat. But this is really crucial to learn how to do. It's very different than what we often are taught in society to how we should run our day. And is often at odds with what providers tell patients. These are providers who may not be familiar with long COVID or related conditions. They often say to push yourself, to try to exercise gradually, increase your exercise. That can actually be one of the more harmful things that you can do if you have long COVID, and can permanently reduce your baseline. So this is a very important thing to learn to do, is to understand kind of your energy envelope, how much energy you have in a day, and being able to prepare for any events that might take up more energy. And then I'd say, so this is more related to seeking care. So first, try to find a trusted healthcare provider who is ideally knowledgeable about long COVID, but at least interested in long COVID and related conditions. And this, what we've experienced a lot as a long COVID community is a lot of dismissal. And that has really come from a lack of understanding from healthcare providers on what long COVID is. Previous post-infectious illnesses have not been well researched. Providers have not been well educated on this. In fact, only 6% of medical schools really taught and researched ME/CFS, or myalgic encephalomyelitis, which is that illness that has that large overlap with long COVID. So it's, to a lot of healthcare providers, they don't know what they're seeing when they see long COVID. And so it's important to find someone who does know or is at least willing to learn. Part of that is, if you're able to, if you have the capacity, your symptoms allow you to, try to stay up to date yourself with the research and keep your doctor informed. You know, a lot of providers, especially primary care providers, might not have the time to stay up to date with this. And there's a lot of great research being shared, stuff coming out almost every day on long COVID. And there are some forums and people on Twitter that do a really good job at condensing that research. And I'll share the article that I was discussing earlier in the chat, which is a compilation of long COVID research so far. And I think this is a really good thing to bring to your doctor, because it just kind of compiles everything and gives some ideas for treatment. Another thing is to try to track your symptoms and your triggers. So tracking your symptoms every day. So what symptoms you experienced every day. There are many apps for this kind of thing, if that works for you, or you could keep a journal. And then also what might trigger a relapse for you. So common things, as I mentioned, are exercise, if you work too much, if you have an emotional reaction. A lot of food can trigger symptoms, different types of food, and menstruation, either the week before menstruation or the week of menstruation. This is also something that, if you find it difficult to remember to track your symptoms, or it's hard to write things down, asking a caregiver, a loved one, to help you with this and remind you of this can be really important. Related to that is bringing a caregiver with you to appointments to help take notes and communicate your symptoms. Having that kind of advocate and support in the room with you, or on a Zoom if you're doing virtual care, can be really crucial. A lot of times it can be difficult to communicate with a provider, and especially if you have cognitive dysfunction, being able to communicate what you need to in that 15-20 minutes that you have with the doctor can be really hard, while also taking notes and doing everything you need to do to have a productive appointment with your provider. And unfortunately, the majority of people with long COVID have had a negative experience with a provider. We've documented this in our research. So it might happen. And if it does, if a provider either doesn't believe your symptoms, or they give you a diagnosis that you're unsure of, for example, they prescribe all of your symptoms to anxiety or depression, ask providers to provide evidence for their diagnoses, for and against any other diagnoses. ask providers about differential diagnoses. So this is all of the range of other diagnoses that could be possible. And then ask providers to document any of those responses and to document any refusal for testing. So if you are asking them to test you for something and they refuse, ask them to document that. And that can help. Usually that changes the conversation a bit, but at least you have the documentation down. And then if you're able to, I recommend trying to find a different provider who is more understanding and more willing to be your partner in care. I put some resources here, but yeah, I would love to hear from Jessica.
Thank you. This is Jessica. A lot of what was just said by Lisa would go in the legal realm as well, is relevant there when you're self-advocating with an employer, with a school, with also with a healthcare provider, and just in a different context, maybe for accommodations. A lot of what Lisa said is still relevant. You want to document things as much as possible and have support for that documentation from either a medical source or from your own information. And it's important to keep records of things in order to lend support to requests and claims should there be any kind of issue or pushback for something that you're asking for.
Thank you, Jessica, and thank you, Lisa. We're gonna give Lisa a break now and transition into the next question, which is, what are the legal rights of someone with long COVID under current disability law? And this question is for Jessica.
Thank you. This is Jessica. And so we wanted to include some information today about a person's legal rights if they have long COVID, because we know that for many folks, this may be the first time in their life that they're experiencing living as a person with a disability. And so they may be wondering what that means for them from a legal perspective. And so here at Disability Rights New York, not too long after the COVID-19 pandemic started, we started to see clients coming to us and asking if long COVID could be considered a disability and what that would mean for them in different areas of their life. As Lisa mentioned, a lot of folks with long COVID see impact, especially on their work. And for people who are maybe not in the workforce, we see a lot of cases with education, whether that be at a level for younger folks or even at the higher education level. A lot of the concerns with how to manage and be accommodated for long COVID that we see come in the education and the employment context. And so I'm going to provide a little bit of background on the law and the state of things, and then also talk through some brief hypotheticals to give you an idea and hopefully some context for what I'm talking about. And I am going to be using some legal terms. I'll try to define those as I go along, but certainly if anyone has any questions about a term that I use or wants to know more about what that means, please don't hesitate to ask. I know that sometimes as an attorney, I will very casually use a term that is in my everyday vocabulary, but might not be something that other folks use very often. So please don't hesitate to ask for any further explanation. So just generally, there are many different laws at the local, state, and federal level which provide protections for people with disabilities. And so that would include most people with long COVID who are experiencing those disabling symptoms that Lisa mentioned earlier. Today, I'm going to focus specifically on the Americans with Disabilities Act, the ADA, which you may have heard of, which is a federal civil rights law that provides certain protections to people with disabilities in different contexts: employment, education, healthcare, public places, access to government programs, mostly anything that you can think of. But do keep in mind that the ADA is not the only law that provides these type of protections. There's also the Fair Housing Act, which would provide protections in a housing context, and the New York State and New York City human rights laws, which just add on to those federal protections for folks that live in New York State or live in New York City. And so all of these provide largely similar protections for people with disabilities, just in slightly different contexts. So as you're looking into these things, you might see some of these different laws used interchangeably, and a lot of the terms that I'm going to talk about come up in discussions about these different laws. So the ADA is not a new law since COVID-19, rather it's an established protection that people with long COVID may be able to utilize if they find themselves living now as a person with a disability. And so under the ADA, you're provided certain protections if you are what the law calls a qualified person with a disability. And so that's one of those terms, qualified person with a disability. And I'm going to talk a little bit about what that means and break it down a little to hopefully provide a good explanation. So a disability under the law is any type of physical or mental impairment that impairs a major life activity. And so a major life activity is a really broad term that includes walking, talking, hearing, seeing, reading, breathing, all of your general organ functions. Those are all major life activities. And so if you have any type of physical or mental impairment that is impacting those, then you would qualify as a person with a disability under the ADA. And so if we take that portion of the term for disability and go back to the larger term, qualified person with a disability, the question then becomes, what does it mean to be qualified? And that part means that you're eligible for whatever it is that you're seeking access to, that you'd like to have protections as a person with a disability when you're trying to access it. So for example, it would mean that you meet the requirements for a job or for an educational program that you're seeking, or that you're seeking to access a government program that you're eligible for within their eligibility requirements, or you're seeking services at a place that's open to the public. So essentially, you are allowed to be there and qualified to be there, and it's just your disability that might be preventing you from fully accessing whatever that thing is. So if you meet that standard, you have that impairment and you're qualified for whatever you're seeking access to, then you are entitled to what the ADA calls reasonable accommodations or reasonable modifications. And those are changes in the way that a program or service or an entity, an organization typically operates that would allow a person with disability to access the program or service, even if their disability is maybe preventing them in a certain way. So the key word when we're talking about accommodations and modifications is reasonable. And I would love to be able to give you a really concrete definition of what reasonable means. But if I could, then I probably wouldn't have a job, because that's essentially what all of the legal work around the ADA and reasonable accommodations focuses on, is what is reasonable in different circumstances. And different people can differ in what they think is reasonable, and we have to defer to precedent and the courts and what the laws specifically list. And there is no specific definition of what is or isn't reasonable, but we generally look to if what the person is asking for is relatively affordable and is something that is within the scope of the type of work or services that are provided by the folks that you're asking for an accommodation from. And what is reasonable will vary in different situations and from person to person, because everyone's disability is different. Even if two people have long COVID, it could be manifesting in different ways, and they might need different things in order to be accommodated. So talking about long COVID a little bit more specifically, the burning question is long COVID a disability under the ADA? The answer is likely yes. The ADA does not provide, an exhaustive list of what does or does not count as a disability. But if you're looking at those things that Lisa was talking about, those symptoms, you're going to see that those meet the definition of disability in having an impairment of a major life activity. If you're experiencing chronic fatigue or difficulty breathing, or you're experiencing brain fog, those are impairments to major life activities. So we are finding success in having folks who are diagnosed with long COVID be considered people with disabilities underneath the ADA and those similar laws. So that means that those people can ask for reasonable accommodations or modifications in their life if they need them to access a part of their job, a part of their education, something that's open to the public, in order to be able to have just a couple things made a little bit more accessible to them. And so, as I mentioned previously, Disability Rights New York as a law office is most commonly seeing those requests from people in the employment and the education contexts, but it does cover other aspects of your life. If you need accommodations in a healthcare setting, for a government program, for a business that's open to the public, all of those things are still covered under the ADA. And so when I'm talking about reasonable accommodations, what do those look like and how does a person get a reasonable accommodation? The first thing that I want to point out is that in almost every single context, except for students in elementary, middle, and high school, it is the person with the disability's responsibility to disclose that they are a person with a disability and request accommodations. It is fairly rare that there are other circumstances when the responsibility would be on the other side to affirmatively offer reasonable accommodations. And so that's something important to keep in mind, is that this is going to be initiated in almost all contexts through self-advocacy, either by the person with the disability themselves or a support person or an advocate or someone like me, an attorney who is representing them and helping them in that situation. And so I have two examples that I just want to give to kind of provide hopefully a little bit of context of what a reasonable accommodation would look like. And so the first one is going to be in the higher education context, and just a little hypothetical that I made up. We're going to say that there is a student named Johnny. He's a sophomore at college and he has long COVID. And his primary symptoms with his long COVID are consistent shortness of breath and fatigue, both of which, like Lisa mentioned, are worsened after periods of physical exertion for him. So several of Johnny's classes are on an upper floor of an academic building on his college campus. And because many of the buildings are old, they only have service elevators that are usually reserved for maintenance staff. As a reasonable accommodation, Johnny can request access to those elevators, even though students usually don't have that access. And that would allow him to get to his classrooms without exacerbating the symptoms of his long COVID. And so we would always say that Johnny should make that request in writing, and he may be asked to provide medical documentation from a doctor that supports the fact that he has a long COVID diagnosis and how that directly relates to what he's requesting. So that documentation would state that Johnny has a disability, that is long COVID, what his specific requested accommodation is, the use of the elevator, and how those two things are connected. So Johnny needs to use the elevator in order to access his classes without exacerbating his disability-related symptoms. So that's one example, and I'll do another example in the employment context, which, as I've mentioned, is one of the two top areas. It is probably the most common area that we're seeing legal issues with long COVID come to our office, at least, is folks who are having difficulty with either a new job that they've gotten since having, being diagnosed with long COVID, or a job that maybe they were working previously, but now their needs have changed because of having long COVID. So in this example, our person's name is Amy, and she is an office manager. She's been working at this position for 15 years and recently was diagnosed with long COVID. So each day for many, many, many years, the office starts with a short staff meeting where the executives would verbally tell Amy what tasks need to be completed for the day that are beyond her standard job tasks. So if they need to order certain supplies, set up a special lunch, or prepare the office for arrival of important clients that day. For years, the executives had been telling Amy what needed to be done, and she would take a few notes herself and go on with her day and achieve all of those tasks. But since having long COVID, Amy has been experiencing symptoms, particularly brain fog, which make it difficult for her to remember the information that is being shared with her verbally by her supervisors. So while she used to be able to quickly jot down a few notes, she now finds herself missing some of those delegated tasks throughout the day, and then frustrating her coworkers who were expecting things to be done. So Amy can ask for a reasonable accommodation. And in this example, the idea that I came up with was that Amy could ask the executives to send her an email in the morning with a list of the extra tasks that need to be completed that day, so that she can easily refer back to the list, and she doesn't need to have the responsibility of creating that to-do list based off that verbal feedback. So like Johnny from the previous example, we would want Amy to make her request in writing, and she may be asked to provide medical documentation in the employment context as well. And so as we're thinking about these examples and just generally about reasonable accommodations and long COVID, we want to keep in mind that a person is not necessarily entitled to the specific accommodation that they ask for, but rather an accommodation that works. So for example, and I know these are very simple examples, so for illustrative purposes, it's usually much more complicated. But for example, in Amy's context, one of the executives could offer to give her a handwritten list of tasks instead of emailing. I think we've all maybe worked with that person who is a little technology averse and maybe doesn't want to send an email, and they'd rather write a handwritten note on a Post-it. That would still accommodate Amy because it would give her the list to refer back to, but it's not the exact accommodation she asked for, but legally that's still okay. So lastly, as many of you are maybe wondering, what happens if the answer is no, we're not going to accommodate you, we don't think we should have to do that, we don't think this is a disability, we think that that's too expensive, if you're getting those type of answers. So again, we always want to ask for that type of answer in writing, and you can, if you're told verbally, you can request that they send it in writing. If the person, you say it's your boss, who is giving you the answer won't send you that response in writing, we would recommend sending a follow-up email to them where you say something along the lines of, I'm memorializing the conversation we had earlier today where you denied my reasonable accommodation request because of A, B, C reasons. And that just provides some type of paper trail that would allow someone like me to more effectively advocate. And so you can contact a place like Disability Rights New York and request direct assistance, from an attorney or an advocate on your issue. There are other legal organizations, legal advocacy groups that provide similar services, and you could reach out to one of them. Or you could go as far as filing a complaint of discrimination with an enforcement agency. So for the federal government, that would be the Department of Justice, or the EEOC, the Equal Employment Opportunity Commission, or for the state, the New York State Division of Human Rights, or for New York City, the New York City Commission on Human Rights. And so those organizations, like I said, are enforcement organizations, and they have the authority to essentially act the same way that a judge and a court would act in TV shows that you've maybe watched about legal processes, where they would investigate and then make a decision on whether discrimination had occurred in that context. So that is an option that exists for folks to resolve denials of their access to things if those denials do come up. So I'm happy to take any questions about any of what I just went over, or send it back to Natasha to continue with the rest of the program.
Thank you so much. That's the end of our questions. Unfortunately, it looks like Dr. Chen won't be able to make it. So we're going to go to the sort of open Q&A portion of the event. And it's looking like we'll be able to end a little bit early. For those of you who have blocked out the full event in your calendars, you'll have a little bit of extra time. With that being said, I do want to reiterate a couple of things that I mentioned in the chat. And at the beginning of this event is being recorded. So I know there's been a lot of really great information. It's a lot to take in. DRNY will be posting this recording on our YouTube channel. And we will be able to send all registrants to this event that link when it's posted. And additionally, when I open this up for questions, I can post a PDF of Lisa's extremely helpful slides in the chat right now, in case you want to use them and sort of sift through any links that were in there, or just to remind yourself of what was being shared before we are able to post the video. So I just wanted to let everyone know Grace has posted the DRNY's YouTube channel link in the chat as well. So now we can open it up for questions. If you'd like to sort of raise your hand and speak the question, that works. If you'd like to write it in the chat, that works as well.
Hi, my name is Ron.
Hello, what's your question?
You said something about foods can trigger symptoms. Which foods, do you know? And thanks, great place. See ya.
Depends person to person, but often what we're seeing are high histamine foods trigger symptoms. So these are foods like tomatoes have high histamine. I can look up other ones because I myself have brain fog, so sometimes forget things. Let's see, like alcohol often triggers, so that's a beverage, but alcohol, fermented foods, avocados, eggplant, spinach. So these are things that have high histamines and trigger your mast cells, which I mentioned that one of the conditions we're seeing is mast cell activation syndrome. So oftentimes eating those foods triggers another reaction in your body. But it can vary from person to person. That's just one example and kind of the more common example of what we see. But yeah, if you are having kind of seeing that maybe after dinner or, you know, a meal, your symptoms are exacerbated, it might be worth trying to cut out some of the like high histamine foods to see if that helps. Gluten is another one. Yes, I have celiac, so I've always been gluten-free. But yeah, gluten is a very common one.
Thanks, Lisa. I see Michelle has her hand raised, so I'm going to give the go ahead.
Hi, thank you, everyone. This has been extremely informative. I am a single parent caregiver, so I'm afraid I messed up a lot of situations along the way while having COVID. But I had a question for Lisa. I was fortunate enough to get into a rehab program for 3 months. As soon as I was testing negative, I had POTS and I had a lot of the typical long COVID symptoms, which have resolved. But at this point, what's left now is cognitive issues, and my immune system is just in the toilet. Like, I literally get sick every single week. There is not a week that goes by that I don't have something. And I was wondering if that is being seen in the research. My doctor finally last night, after they put me on an antibiotic for a sinus infection and bronchitis, said you need to look at your immune system, because my doctors just really don't know what to do. So I was wondering if anyone is seeing that in the research, that people's immune systems are affected and get sick a lot. So it's making me isolated. It's making me depressed. I can't go find another job. I got fired while I was on FMLA. So I just need to get my immune system in order.
Totally. I'm so sorry to hear that. That sounds awful. We are seeing that quite a bit in the research, that people's immune systems are triggered, and we have a little bit of that in the review that I posted. So that goes more into detail on the effects on the immune system. So recommend sending that to your providers and pointing out the immunology section, which might be helpful. But yeah, so sorry to hear that.
The next question seems to be from Suzanne, who asks, in the midst of my long COVID, I also was diagnosed with breast cancer and had surgery, radiation therapy, and currently aromatase inhibitor treatment, sorry, excuse my pronunciation. How does one prove for legal purposes what is from long COVID and what is from other causes? I think Jessica might be able to answer that one.
This is Jessica. Thank you for that question. For folks with multiple disabilities, there is not necessarily a requirement that you divide all of your symptoms up and attribute them to a single disability. And cancer is a recognized disability under the ADA and those other laws that I mentioned. So you wouldn't necessarily have to say that this symptom is long COVID and this symptom is cancer related. It would probably be best to get a doctor who could maybe write that, you have both of those things working in tangent that are, causing these symptoms. We do see some people who see perhaps a doctor who specializes in cancer and would maybe be most comfortable talking about the symptoms that they know and have experienced in the past coming from cancer. And then you could have another medical note from a different practitioner that talks about your other symptoms, but there isn't necessarily a right or wrong way. What we want to see is just a doctor saying, my name is Dr. So-and-so. I treat this patient. They have these diagnoses that causes these symptoms. And then, like I said before, if you're requesting an accommodation, then you go into the specifics of how what you're requesting and those symptoms relate to each other. But there isn't necessarily a legal requirement to divide everything out very neat and tidy, because we do recognize that these things are very rarely neat and tidy. Like I said, I know my examples were very simplified, and we do recognize that that is not typically the reality of what we're looking at.
Thank you. Our next question is from Guadalupe, who asks, how can brain fog be clinically documented to show that it is a disability? And I think just the idea of documenting brain fog, perhaps in general, could be a tricky one. So I don't know if both of you might want to answer that from different perspectives.
Testing that you can do. So there's some like cognitive testing that you can ask your provider to do. I'm blanking on the names of them, but I can look that up quickly and put some of that in the chat. But it's really getting your provider to do the right tests that then document the severity of the symptom. That's from at least what I know of. I'm not sure if Jessica, you agree with that.
From a legal perspective, when I'm talking about documentation, I don't mean your medical records. It is a rare situation where an employer, an educator, someone you're asking for an accommodation from is entitled to your actual medical records. That might be a situation if you get deeply into litigation or something like that. But when I'm talking about medical documentation, I'm talking about, it's usually a letter from your doctor with very limited information. And the person who's asking for the documentation is only entitled to the minimum amount of information that they need to basically verify that you actually have a disability and that the accommodation you're asking for is related to that. So if we're talking about documenting your disability and a disability that may be difficult to prove medically, basically from a legal perspective, again, I'm not a doctor. From a legal perspective, we just need you to have a doctor, a medical professional who says that you have that. They don't need to talk about how they diagnosed it or anything like that. They just need to say that you have it and then talk about how it relates to the accommodation that you're looking for.
Thank
I'm
you.
interested, this is Lisa, question for Jessica. For applying for disability benefits, though, is that different? I know that providers need to give a lot of information for when applying for disability benefits.
So this is Jessica. I will put this caveat out there that our office, Disability Rights New York, well, we do have disability in our name, we're talking about usually those legal statutes and not disability benefits. We are not an office that helps people generally apply for disability benefits. But when I'm talking about the definition of disability, I'm talking about that in the context of the ADA. That definition is different in the context of applying for benefits. And for anyone who is a veteran, I know that there is also different definitions for if you're a disabled veteran and percentages of how disabled you are and things like that. Those things are different than what I'm talking about with the Americans with Disabilities Act. And with that, it's also important to note that even if you've been denied disability benefits, that does not mean that you are not eligible for reasonable accommodations or protections under the ADA or those other laws that I referred to. They are not necessarily mutually exclusive. And if you have questions about those things, you can and should reach out to our office, and we can provide more information and context and clarify some of those things, because we do recognize that it can be very confusing. And we're using the term disability in a specific context that goes with that process that I was talking about. But we recognize that it's also a term that is used just casually in people's everyday lives, but then otherwise with strict definitions in other contexts as well.
Thank you both. Megan asks, Lisa, if you don't mind answering, how was the process of getting the reasonable accommodation of flex time at work that you mentioned?
So I joined Patient-Led Research Collaborative. Well, we started it back in April of 2020, May of 2020, so very early on. And then I just did that part-time for a while, but then ended up going full-time with PLRC, Patient-Led Research Collaborative, last May. So I have the ability to set my own schedule, so I haven't needed to request that from any workplace as of yet. So I'm in a very lucky situation with that, and we really try. We now have about 15 employees, and we're trying to really practice what we preach. So have, everyone has whatever schedule that they want and has all accommodations that they need in order to work and to push forward this long COVID research. But yeah, so I haven't been through that process.
Thank you, Lisa. One more question, sort of specific. Are there any accommodations that can be available in the process of applying for disability benefits, or in the process of applying or requesting accommodations themselves? For example, a single mom having trouble meeting deadlines to submit forms, documents, etc.
This is Jessica. So yes, absolutely. A person with a disability would be entitled to accommodations in either of those contexts. I will note that the reason for the accommodation cannot be, under those laws at least, that you are a single parent. That is not a disability, though I do recognize that it is something that would obviously have a huge impact on your time. But since this is a long COVID panel, I will assume that on top of that, you're probably experiencing long COVID symptoms, which are maybe making things more exhausting and taxing than they might typically be for a person who does not have long COVID. And so to take that in two parts, in applying for disability benefits, I did mention that that is not a process where our office specifically advocates for a person to get benefits, but that is a government program or service, and that does fall under the ADA, specifically Title II. And so you would be entitled to accommodations in that process, and that would be the same request process that you're looking at in any other context, that you would want to reach out to the folks that you're submitting that application to, let them know that you're a person with a disability and how that manifests, how that looks day to day, and what accommodation you need in order to accommodate that disability. So perhaps you need extended deadlines, perhaps you need to meet with someone either in person or over the phone who can assist you in filling out forms. different things. And there is no, just like there's no list of what is a disability, there is no list of what is or is not an accommodation. So you can ask for pretty much anything and, kind of start working from there on where you can get. That is a situation where they're likely to ask for medical documentation, verifying that you are a person with a disability and how that necessitates those accommodations. And then it'd be really similar for the accommodation process with your employer. Most employers that I have seen and I have worked with, their accommodations process is that you reach out to the HR department or another designated person and again say, I'm a person with long COVID, I'm experiencing brain fog, so I'm having trouble with XYZ, and I'm looking for ABC accommodations. And if typically that employer has, specific deadlines of, okay, well, we need you to provide us a doctor's note in 10 days or something like that, you can break that process down and ask for accommodations and extensions of those deadlines based on your disability as well. So everything from what counts as a disability to what is a reasonable accommodation and the whole process in between is very customized to the particular person. And the law is very, very clear and well established that that has to be an individualized process and assessment of the disability and that person. And so with that, if generally the response you ever receive to a reasonable accommodation request is, we don't do that for anybody, or if we did that for you, we would have to do it for everybody, that is not an okay response, and that is an illegal response. And you can reach out to an office like ours for assistance in navigating that.
Thank you. The final question, which might not be able to be answered. Sorry, not the final question. The recommended long COVID care docs in LINY area, especially for cousins with long COVID in Snowmass, Colorado area, or somewhere else in Colorado, needs to use an O2 tank to breathe. So this question, I think, is more of like, do we have resources that list post-COVID care clinics or facilities that I think are good for long COVID treatment?
This is Lisa. I just put a link in the chat, which is a list of recommended providers. And this is something that was developed by the Body Politic COVID-19 support group. So this was just folks within the support group who had experiences with different providers submitted this. So it's not, these aren't vetted, but just from different patients' experiences. And I think you can sort by state. It's fairly expansive. So hopefully there's someone in your area there. There are a few different long COVID clinics as well that might be worth looking up, but we see really mixed responses and reviews from those. So worth maybe trying to find another person with long COVID and asking who has been there to ask for their experience, because not all of them are high quality and really worth your energy. So in New York City, the Mount Sinai one, which Dr. Chen is part of, that one is amazing. But I don't want to speak for all of the clinics.
Thank you, Lisa. Jeremy asks, are you familiar with case studies on NAC to treat brain fog? Jeremy does spell out the full treatment name, which I am not going to even pretend to be able to pronounce in the chat. And I'm assuming this would go to you, Lisa.
Some stuff, Jeremy, I could follow up with you on that. Because I'm not going to be able to recall it in the moment, unfortunately, but I can follow up with you if you want to send me an email. I put my email in the chat up above.
Another follow-up question from Deborah, can someone be denied post-COVID care if they never tested positive for COVID?
Standpoint what the answer is, but we are seeing this happen. So a lot of the post-COVID clinics require a positive COVID test. And some providers are only giving diagnoses of long COVID to people who have a positive COVID test. That part requiring a positive test to get a diagnosis is not acceptable. That's not what the CDC defines as like a requirement for a long COVID diagnosis. But unfortunately, we are seeing denials of care still, but there are still clinics out there that don't require that.
All right, I believe, yep, we are done with questions unless I missed any. It's 1:15. We're gonna wrap up 15 minutes early. I'm gonna put my email in the chat in case anyone had specific questions for Dr. Perlis or Dr. Chen that I could perhaps connect. That's my email. So please just email me directly if you have any specific questions for, again, Dr. Perlis or Dr. Chen. I want to thank so much Jessica and Lisa today for providing really excellent and important information about long COVID and, you know, advocacy and accommodations and sort of tips for how to navigate that. I would like to thank Grace for helping out with tech. I would like to thank our ASL interpreters and our closed captioner. And I hope you all have a wonderful day. Again, this will be posted on the DRNY YouTube channel, and Lisa's slides will also be linked when that is posted. It's currently linked in the chat. So again, any follow-up questions, please feel free to email me, natasha.bynum@drny.org. And yeah, have a lovely day. Thank you.